Hi, everyone. I'm Dr. Sheppard with Align Family Wellness, and welcome to today's episode. Today, we are going to be talking all about the myths of chiropractic care. So, everything you have probably seen on TikTok or heard about, or just things your family members or parents have said about chiropractic care, we are going to go over today, and we are going to debunk all of the myths, and we are going to talk about all the stuff. Okay, so we're going to dive right in. So the first myth that you see or you hear all the time is that chiropractors are not real doctors. And so that's just funny to me because it's like, what does a real doctor mean? Like a dentist is a type of doctor, a podiatrist is a type of doctor. So we're going to go into like how we become doctors and what our education is like. And just so you have a little bit of background on that. So basically, chiropractic school is a minimum of 8 years. So we have 4 years of undergraduate, and we also have 4 years of chiropractic school. So my chiropractic school ran on trimesters. So it was 5 academic years condensed into about 3.5 years because we go to school during the summer, which was actually kind of amazing because who needs summers off? So you might as well get done with school. I have a bachelor's in science in anatomy. So I actually do have a bachelor's degree that I obtained. Most people come in with some sort of biology, exercise science, some type of bachelor degree that is science related. And then they move on to their doctorate program in chiropractic school. So the number of classroom hours that chiropractors have versus medical students. Chiropractic school is a minimum of 4,200 classroom hours. And to be accredited, it has to be 4,480 to 5,200 hours. So most chiropractic schools are accredited at that 4,000 to 5,000 hours. There's about 16 chiropractic schools throughout the nation. So medical school classroom is around the same, about 4,250 hours. The difference is chiropractic care gets a lot more anatomy and physiology, and we get adjusting and more chiropractic specific classes. So medical schools would have more on like public health and pharmacology, which we get some of that. But remember, as chiropractors, we don't dispense medication or do surgery as part of our holistic mindset. So we need to understand how medications work in our patients, but we don't need to know how to like dispense the medications because we don't do that. So our classes are focused more on adjusting and chiropractic philosophy and things like that. So we are actually considered physicians. We have a physician license in the state, right? For me, the state of Illinois. So we are trained in cardiology, gastrointestinal, obstetrics, gynecology, and pathology, and even phlebotomy. So, we had to learn, how to do gynecological exams. Not that I would ever do one in my office. We learned how to draw blood. We learned how to look at stuff under the microscope, but not stuff that most chiropractors do. I do have a lot of friends that do pelvic floor physical therapy, which, all that training comes in hand. So we do get a well-versed, we do listen to hearts in the office. We do listen to lungs. This is stuff that we do behind the scenes that you guys don't see. We can refer out for blood work, MRIs, x-rays. We can refer to other physicians. So that's kind of the difference between doctors of physical therapy. They are not physicians. So they can't refer out for like MRIs and stuff like that. So we are board certified and licensed. We have to take a 4-part national board examination with a practical examination at the end, which means you are actually physically, performing stuff, examinations, adjusting. That is our whole part 4 is a practical exam. We take a national board on radiology, physiotherapy. So over our education, we are taking 4 national board exams, which is a ton of stress. We do have our own sort of residency program. We have a student clinic, an outpatient clinic, and then an actual preceptorship where you can work with doctors in the field in your last actually trimester of school. So, it's just funny to me. Just because we don't do drugs or surgery does not mean we're not real doctors. We have a lot of extensive training. Actually, a lot of people use us as somewhat of their primary care physician. I get asked on a daily basis to like, hey, will you look at my skin on this? Or what do you think about this? Or what's going on here? Like, we have to be well versed in a lot of things because we see people so frequently that a lot of stuff comes up that, we have to be able to triage and say like, oh, that's no big deal. Or, hey, you need to see your family doctor about that. Or, hey, let's refer you to somebody who's more specialized. We have a ton of people that come in that we're ruling out like kidney stones that present as back pain, all those things. So we are real doctors, whatever your definition of real doctor is. But we have a lot of extensive training and our schooling is pretty intense and rigorous. Okay, so let's talk about the elephant in the room. Neck adjustments. People are terrified of having their neck adjusted. So I do see how like TikTok and those things, it can be really, really harmful for business. And then some people are addicted to the crack sound and actually love it. But, it can be a little bit scary. And some of those things on TikTok, please understand, are not actual techniques that are taught in school. So, the Y strappy thing on the neck and things like that. Those are not true techniques. A lot of that, the sound is amplified and people are wearing microphones or they're adding in additional sounds. But people get fear neck adjustments, whether it's, oh, I'm going to die or I'm going to be causing a stroke. Please understand that the media says 1 in 5.7 million patients suffer a stroke in the days following a chiropractic treatment. So it's not in that moment and it's days following. And a lot of times it has nothing to do with the adjustment. So for example, if you are taking ibuprofen, side effects happen in 1 in 100 people. So the media states side effects that can happen days after an adjustment is 1 in 5.7 million. So you have a bigger risk of taking that ibuprofen that y'all be taking every day than you do of having your neck adjusted. So there are with, NSAIDs like ibuprofen, prescription medications, there are 16,500 deaths per year and over 103,000 hospitalizations for taking medication, non-steroidal anti-inflammatory drugs, Aleve, ibuprofen. Then you've got prescription stuff such as tramadol, Toradol. All of those things are prescription medications that cause 16,500 deaths per year. If my profession caused that many deaths per year, you all would hear about it. It would be huge news, but it truly doesn't happen. Our malpractice insurance is so affordable because we are careful about what we do. So I'm just going to quote some literature here. So in the Annals of Medicine, let me start over. The Annals of Medicine Comprehensive Literature Review. Quote, manual therapy does not result in an increased risk for cervical arterial dissection. So that's what you usually hear about what causes strokes is their cervical artery dissects. That is not, manual manipulation does not result in an increased risk of that. So another study, a Cassidy study comprising 100 million patient years of data, 100 million patients and years of data. Quote, there's no evidence of risk of stroke associated with chiropractic care compared to primary care. It is actually 76% lower. And so this is huge. Like, it's not like patients are having an issue in our office versus a medical office. Most people who are having strokes have them in a medical office because they're going in because they're symptomatic. Unfortunately, some people, it does bring them into the chiropractor because they're having headaches or numbness in their face, things like that. They're more likely to go to their primary care over, for those symptoms because they get kind of scary. Most people who are having a stroke or have had a stroke with chiropractic have already had symptoms or are having symptoms when they are in the office. So it's just important to know that a lot of times we have to rule out history in the patient and kind of what's going on. But there is no evidence of excess risk of stroke with chiropractic care. So there's another finding from a review of 39 million patients, and I quote, "There's no significant association between stroke and chiropractic visits. Manipulation is an unlikely cause of stroke." And the last one. So this conclusion this is from the same Serious Journal, and I have all of these, if you really care, I have them all the data that you can look back. So just let us know. But this data says, quote, "No excess risk of stroke for chiropractic manipulation compared to primary medical care." Okay. So I'm going to read you one more thing. And I know you guys don't want to hear, much more about the actual research, but it's important to know that once again, in the Annals of Medicine, it is quoted, "The assumption that the cervical manual therapy intervention triggers the cervical arterial dissection in rare cases has been dominated by single case reports and retrospective case studies or surveys from neurologists who naturally lack substantial methodological quality to establish definitive causality. These neurologic case reports have probably contributed to the over-reporting of serious and catastrophic adverse events." So they're saying things that have been reported are single case events. And a lot of times there's lack of evidence and it's over-reported and showing more issues than there really are. So patients with symptoms of impending stroke have a higher likelihood to seek care from a provider. That is what I'm telling you. Most people are symptomatic, so they're going to come in to the family doctor. They're going to come into our office. Chiropractic or medical care is not the cause of the stroke, but it's a contributory midpoint in the development of a crisis. Problems trigger doctor visits, not the opposite. So they are already mid-problem when they come into the doctor. And so people have had strokes at a hairstylist. When they lean back, they can compress on those arteries and cause a stroke, but they were probably already set up for that. It's not the hairstylist's fault or because they put them back in the rinsing bowl. Happens thousands and thousands and thousands and thousands times a day. And so think about if this was truly, truly a problem, wouldn't chiropractic students be stroking out patients every single day? Because they don't know what they're doing and they're getting in there, they're thrusting wrong, they're doing weird stuff, they're practicing on each other. Wouldn't we have more issues with the thousands of chiropractic students that are practicing on cervical manipulations every day? The truth is, it's not there, you guys. The research is not there. It's not there. You are more scared of this than you are of your normal, really bad habits that you're doing every day. Taking ibuprofen, drinking alcohol, eating really, really bad food for you, not exercising. Like, stop being scared of the adjustment when it is not anything to be scared of. And, we examine and we screen patients and we do a good assessment before we determine what type of manipulation is correct for that patient. My elderly patients that I don't really see too much of anymore are not getting what we call a high velocity adjustment. I had a patient ask me the other day, like, am I going to crack her baby's neck? So please hear me now. All of you hear me now. We do not crack babies' necks. That is just horrible practice. Babies don't even have ossified joints. Their bones are, kind of cartilaginous and fibrous before they all fuse together. There's no possible way we could crack your newborn baby's neck. And we know that's scary. That is not something we do. That's not our target of care. We are using gentle pressure on babies, very, very gentle pressure on babies. But, the bottom line of all of this is that chiropractic care is super safe, and it's the best choice for patients with neck pain and chronic headaches versus taking these NSAIDs or prescription medications, because I just showed you the research that shows that those are way worse than being adjusted. So, when people come at you and they're like, "Oh, why do you go to the chiropractor? Because it's so dangerous." I'm sure they're taking 15 medications that are way more dangerous than coming to the chiropractor and getting your neck adjusted. So hear me out on that. Chiropractic care is safe. Having your neck adjusted is safe when you have been examined properly. And we do not crack your baby's neck. So That's just my soapbox, and I'm going to stand to that. And I just want you guys to know, please don't be afraid of coming into the office. We are very gentle. We take such good care of you, and we make sure you are comfortable. A lot of people just are like, I don't want to have my neck adjusted. I don't like that sound. Okay, great. There's a lot of different ways we can do it. We've got, drop pieces. We've got instruments that we hold in our hand called an activator or an arthrostim. There are ways we can adjust you that don't involve any cracking whatsoever. All the cracking is joint fluid moving around. Just like when you bend down and your knees pop or your knuckles pop. It is just the synovial fluid and the gas, the nitrous oxide being released from the joint that makes that noise. So it shouldn't scare you. It's not your bones cracking. It's just the fluid and the gas. Okay, soapbox done on that one. So another thing I want to talk about is once you go, you have to keep going. So there are two types of care. There is pain-based acute care, and there is wellness or maintenance care. So it just depends on what camp you want to subscribe to. It doesn't matter to us. But if you have never had back pain before and you sleep wrong on your neck and you hurt your neck, and in 4 visits, I get you better, okay, you can be done and you don't ever have to return. But if you have chronic neck pain, chronic headaches, chronic low back pain, 3 visits is not going to fix you. It is just like brushing your teeth. Once you stop brushing your teeth, that plaque is going to continue to build up, and then you're going to get problems with cavities. Same thing happens with your neck and your back pain. We can get it under control, but if you want to keep it under control, you have to keep coming back and keep that wellness and maintenance care. And why is it a bad thing if you have to keep going to the chiropractor? You shouldn't have to keep going 3 times a week for the rest of your life. But why is it a big deal to keep your headaches under control if you're coming every 2 weeks or once a month? Like, to me, that is so much healthier than taking medication or, constantly being on, prescription migraine medications or feeling horrible all the time. Coming in for 15 minutes every 2 weeks or once a month should not be considered a bad thing. But people are too used to the sick model of healthcare. I only come when I'm sick and I want you to get me better, and I don't want to see you again. I don't want to take care of my health. I don't want to do anything preventively or proactively. And so if that is your mindset, that you just want to come when you hurt and you want 3 or 4 visits and you don't want to see us again, we are not the office for you. We are a wellness maintenance care office. We want to take care of you for the long term and keep you feeling well. We are not express care for back pain. There are a lot of those out there. There's a lot of walk-in clinics. There's a lot of, auto case places. By all means, please get your adjustments there. They will love to take care of you and get you better in 3 visits and never see you again. That is just not how we work. And understand your stress, your lifestyle, your poor posture, your lack of exercise, your crap diet, all has to do with why you're not holding your adjustments and why you have to come back so frequently. So you ultimately get to decide your care. You get to decide how you want to do this. We suggest what we think is best. We tell you, in our office, we do scans, and our neurologic scans will tell you, will help tell me exactly how much care is going to take to get you better, depending on kind of what category you are in your exam. But we just suggest, we tell you what we think is best, and you take it from there. You don't have to move on to wellness care once you complete your treatment plan. You don't have to do that, but understand that you're going to come back and see me again, and it's going to cost you a lot more money than if you just maintained or prevented. Okay, enough on that. I get pretty fired up about all this stuff, as you can tell. Okay, so the last thing we're going to talk about today is, well, you don't take my insurance, or my insurance doesn't cover chiropractic and it's expensive. So we dealt with this a lot the first half of the year when we were not billing insurance. So it is a mindset thing about how you guys feel about insurance. Insurance is about sick care, not health care. They do not care about keeping you well and maintaining your wellness. Insurance is about taking care of you when you are sick. So understand, on our point of view, it is way cheaper for you to have regular chiropractic care than to do back surgery or to even do physical therapy. Those are very, very expensive. But we also have to think about making it normal for people to spend their own money on healthcare, and especially places that love you and care for you and invest in you, to pay good money to see them, even if your insurance doesn't cover it. And there are lots of ways out there that you can do that. Health savings accounts, and even like flexible spending accounts help do that, but they aren't offered as much to people. And people don't budget in their healthcare as part of their monthly budget. Most people don't understand insurance, and they don't understand how frustrating it is. Some of our patients got to see that the first 6 months when we were not able to bill insurance, and they were just so frustrated and, just waiting for the money and being so mad. And that's our lives times, the thousands of patients that we see each week. That's what we deal with. But we know it's important to you, and we are going to do our best to serve you with carrying Blue Cross Blue Shield and being able to bill that for you. But please understand that, they're going to tell you they're going to cover stuff, and they may not. They're going to only cap out your visits for so much. They're only going to give you so much care. Like, there are some really big plans in town that give you 12 visits, like, for the entire year. That's so stupid. But they give you unlimited physical therapy, which I love physical therapy, but it costs 3 to 4 times what it does to come into my office and have your adjustment. I know it's a different, we kind of do different things, which is perfect, but also they're giving you unlimited visits at $300 and $400 an hour when it costs you $60 to come see me. So, I just want to normalize spending the money for good care. It is affordable. It is something that we can definitely budget for you and help you be able to work through, if you have budgetary concerns. And we, even with, your high deductible plans, we can spread that out for you. But understand that your insurance doesn't care about your health. They are there, they are for profit, and they want to make money, and they want to cover as minimal amount of things as possible. So I hope this kind of helped going through some of the chiropractic myths that maybe you have heard. If you have any questions, if there's other ones, if you guys want this research, you can reach out to us. In the show notes is all the ways you can reach us. If you've been afraid of chiropractic care before, but now you think you want to get started, head to our website, register as a new patient if you're local here to the Central Illinois community. We would love to take care of you and your family. And we just can't wait to see you. And until next time, we will have another great episode for you. So hopefully you enjoyed this one. Let us know. Please comment. Please share with everyone. Anybody please share this on social media so we can help more people. So appreciate y'all, and we'll see you next time.